Hello, my name is Sarah Salem. In this video, we'll talk about antidepressants and anti-anxiety drugs. The topics which we are going to explain are, firstly, an introduction, then mechanism of action, side effects of these drugs, and despite the pharmacological effects of these drugs, we'll talk about how you can naturally heal depression and anxiety. So first of all, depression is a common mental health problem that involves persistent feeling of sadness and loss of interest in activities. We all have experienced feeling of sadness, feeling down, and loss of interest or pleasure in daily activities. They are familiar feelings for all of us, but if they persist and affect our lives for too long and continuously, the issue is depression. So depression is an ongoing problem. Here are some common symptoms of depression, which are feeling low, uncontrollable emotions, change in body weight, the person eats a lot and becomes overweight, or has no appetite and becomes underweight, mood swings, hopelessness, feeling anxious and worried, suicidal tendency, thinking about suicide and hurting themselves, insomnia, inability to fall asleep, and trouble concentrating, remembering details, or making decisions, or the person feels tired all the time without any reason, or feeling of guiltness or worthless. These are symptoms of depression. Causes of depression. A person might become depressed due to physical health problems like cancer, stroke, chronic pains, cardiovascular disease might affect someone to become depressed, or genetic factors, hormonal changes, especially in females, traumatic events like death of a loved one in the family or close person, using alcohol or drugs, changes in the brain neurotransmitter level. Depression is associated with changes in the level of neurotransmitters in the brain that help nerve cells to communicate. So the most important neurotransmitters in the brain, which are serotonin, norepinephrine, and dopamine, they are chemical messengers in the brain. Nerve cells of brain communicate through these neurotransmitters. These neurotransmitters are responsible for mood regulation. So if any change or decrease in the level of these neurotransmitters cause someone to become depressed. Anxiety, a mood disorder characterized by somatic, emotional, cognitive, and behavioral components encompassing chronic fear, dread, worry, and panic attacks. It's okay to feel anxious in occasions like when you have an exam, or when there's a job interview, or presenting something in front of a group of people. It's okay, but if they persist for too long, so it's called anxiety disorder. Symptoms include feelings of nervousness, increased heart rate and breathing rate, and also sweating, dry mouth, dizziness, trouble sleeping, nausea and stomach problems, and inability to concentrate, and consistently feeling panicked. Antidepressant drugs. So these drugs doesn't cure depression. They can just treat depression. Our medications used to treat major depressive disorder, some anxiety disorder, some chronic pain conditions, and help to manage some addictions. They are taken for at least 4 to 6 months. So you can't just stop taking antidepressants, because if you stop doing it, it will make the symptoms worse. Antidepressants relieve depression by affecting levels of neurotransmitters. As I said, these neurotransmitters have a big impact in the brain, which causes someone to become depressed. So antidepressants regulate these levels of neurotransmitter, and someone feels normal with it by taking these drugs. Anti-anxiety drugs, anxiolytics, are a type of medication that helps to relieve anxiety. When someone is depressed, they always feel anxious as well. So many doctors prescribe antidepressants for anxious and depressed patients because they coexist together, like symptoms are together in the same person. So we have 5 classes of antidepressant drugs. Each class acts on a different neurotransmitter or combination of neurotransmitters. First one, we have selective serotonin reuptake inhibitor, treats depression by inhibiting serotonin reuptake in the brain, so the levels in the brain increases, so depression is treated. We have some drugs like sertraline, fluoxetine, paroxetine, citalopram, escitalopram. Tricyclic antidepressants include amitriptyline, nortriptyline, imipramine, desipramine, doxepin, trimipramine, and many others. Serotonin norepinephrine reuptake inhibitors drugs include venlafaxine, desvenlafaxine, duloxetine. Monoamine inhibitors include phenelzine, tranylcypromine. Atypical antidepressants like bupropion, trazodone, mirtazapine. And we have some classes of anti-anxiety drugs like benzodiazepams, which relaxes the skeletal muscle and calms the limbic system. Drugs include diazepam, oxazepam, lorazepam. And azaprions include buspirone and gepirone. Barbiturates, which slows down the transmission of nerve impulses from the brain to other parts of the body. Drugs like phenobarbital and pentobarbital. Beta blockers are medications that work by blocking the body's reaction to the stress hormones that are released during the fight or flight reaction. The drugs include propranolol, atenolol, and antidepressants, which are given to anxious person, like selective serotonin reuptake inhibitors, drugs like fluoxetine and paroxetine, and also serotonin norepinephrine reuptake inhibitors like venlafaxine, duloxetine. Thank you.
Hello, my name is Marwa Kawa, and today I'm going to talk about the mechanism of some antidepressant drugs. So, أو antidepressant drug أنا دتواني therapeutic response كمان لبودرز بكا أويش برregulation actiony هندك لنeurotransmitter كان وكو serotonin, which is the most common one, and norepinephrine and dopamine. باشا أو نيروترانسميتر كان دردرين للاين بريسينابتيك فيزيكلا كانوا وبايندا بن لقر بوسينابتيك ريسبترز كاتك كبايندا بن لقر بوسينابتيك ريسبترز أو induce emotional excitation دكا كواتا دتواني برين كديفيشنسي لو نيروترانسميترانا دتواني ببيته هوي سببي depression. Kawata, the major principle of these antidepressant drugs is to increase the concentration at their postsynaptic receptors. Okay, so according to their mechanism and mode of action, these antidepressant drugs can be classified to several classes. Okay, today I'm going to talk about the selective serotonin reuptake inhibitors, which is the most common one, and monoamine oxidase inhibitors. Okay, the selective serotonin reuptake inhibitors, okay, are a group of chemically diverse antidepressant drugs that specifically inhibit serotonin reuptake. Fluoxetine, fluvoxamine, and paroxetine, those are the most common antidepressant drugs. Okay, so babzanin selective serotonin reuptake inhibitors can tonkardaka. Okay, so this is the neuronal junction before the treatment. أجر تماشي إيران بكين أو نيروترانسميتر كان كتك للاين بريسينابتيك أو دردريت أو للاين سيروتونين ري أبتيك بورا كان لقر إنهبيتري ريسبتر كان دوبارا ري أبتيك دبتوا أماش ولي دكاكا كونسنتريشنا كان ين لسينابتيك لفتا كانوا كم بكاتو بمش أكتيفيشني بوست سينابتيكا كانوا ناكرت. بەڵام کاتێک بەکارهێنانی ئەو درۆگانە ئەوە هەر یەکە لە سیرۆتۆنین ڕیئەپتێک پۆڕەکان لەگەر ئینهیبیتەری ڕسپتەرەکان ئینهیبت دەکا لەیان نەگەڕێکە دووبارە ڕیئەپتێک بکاتەوە بەمەش کۆنسنترێشنەکانیان زیاد دەکات و ئاکتیڤیشنی پۆستسیناپتیک ڕسپتەرەکانەوە دەکرێت بەمەش تێراپیوتیک ڕسپۆندێکمان لە بۆ دروست دەکات. Monoamine oxidase inhibitors, they have a different mechanism. بس بێشەمشتە چی دەبی بزانین کە monoamine oxidase چییە. Monoamine oxidase ئەنزیمەکە لەلایەن مایتۆکۆندریاوە دەردەدرێ. ئەویش لە نیورۆنال سێڵ و هەندێک سێڵەکانی وەکو لیڤەر و گەتەوە دەبیندرێتەوە. ئیشی monoamine oxidase وەکو safety valve ئیش دەکە کاتێک کە نرڤ لە حالەتی ڕێستە ئەو مۆنۆئەماین ئۆکسیدایزە نیرۆترانسمیتەرەکان خڕ دەکاتەوە لەناو ڤیزیکڵەکان لی ناگەڕێن بێتە دەرێ لیکاوت بکە. کەواتە ئیشی مۆنۆئەماینەکە وەکو ئیناکتیڤیتی ئەکسس نیرۆترانسمیتەر ئیش دەکە. ئەستا لە حالەتی نۆرمەڵ ئیشی ئەو مۆنۆئەماینە لێ ژمارێکی کەم لە نیرۆترانسمیتەرەکان لیکاوت دەکات لە بۆ نیورۆنال جەنکشن. بەڵام لە کاتی بەکارهێنانی درۆگەکە ئەوە مۆنۆئەماینەکە ئینهیبیشن دەبی ئەمە ژمارێکی زۆر لە نیرۆترانسمیتەرەکان دەردەدرێت و پۆستسیناپتیک نرڤەکانەوە ئاکتیڤیشن دەبی و تێراپیوتیک ڕسپۆندێکمان لە بۆ دروست دەبیت.
Side effects of antidepressants and anti-anxiety drugs. The side effects are nearly the same, but those of anti-anxiety, especially benzodiazepines, are more severe and last longer. The side effects of both drugs include nausea, increased appetite and weight gain, which can also increase the risk of related illnesses like diabetes type 2 or hypertension, loss of sexual desire, fatigue and drowsiness, insomnia. Some antidepressants like fluoxetine are more energizing, which can be right for someone who sleeps often, while some drugs like fluvoamine have drowsiness for those who are often anxious or have trouble sleeping. Other side effects can include dry mouth, blood vision, constipation, dizziness, agitation, irritability, or in cases when only antidepressants are taken in, anxiety. Antidepressants and anti-anxiety can cause unpleasant side effects. Signs and symptoms such as nausea, weight gain, or sleep problems can be common initially. For many people, these improve within weeks of starting these drugs. In some cases, however, these drugs can cause side effects that do not go away. One, two, three. Side effects of benzodiazepines. These are more, the side effects include 1, 2, 3. Side effects of benzodiazepines. They are more affected. One, two, three. 1, 2, 3. The side effects of benzodiazepines. These drugs, or this drug, it affects the central nervous system more. So the symptoms that are shown are more affected or related. 1, 2, 3. The side effects of benzodiazepines. This drug, it affects the central nervous system more. So the signs and symptoms are more related to the central nervous system. For example, we have poor balance or coordination, memory problems, slurred speech, trouble concentration, confusion, headache, blurred vision, And of course, drowsiness, dizziness, and we also have stomach upset. Quitting anti-anxiety or antidepressant drugs can cause withdrawal symptoms within a day or two. In case of anti-anxiety, can last longer. These symptoms can be like fatigue, irritability, anxiety, extreme depression, flu-like symptoms like the person will get chills or their muscles will hurt, insomnia, so sleeping problems, hypertension. But compared to antidepressants and anti-anxiety, the withdrawal symptoms of benzodiazepines are more severe. These withdrawal symptoms, include increased anxiety. The person will get regularly more panic attacks, insomnia, restlessness, depression, confusion, a pounding heart, so irregularly heartbeats, sweating, and in severe cases, seizure and stomach pain.